This is Grassroots Television.
For over 50 years, the companies of Kaufman Holdings have been technology leaders in high-performance lubricants for aviation and industry. Through biodegradable chemistry and enhanced productivity, the products of Kaufman Holdings save energy, reduce waste, and help protect our environment.
Hello, and welcome to The Changing Paradigm. I'm Dr. Patricia Hill, and today my guest is Dr. Kenneth Pelletier, who is a professor of medicine and one of the reigning experts in alternative medicine. Welcome to the show, Dr. Pelletier.
Thank you. Good to be here.
Or may I call you Ken?
Ken is fine. Please, I've been knowing each other for so long.
Ken and I've actually known each other since, I think it was about 1984.
Yes.
Or no, actually it was
That's
before
even earlier.
that. It was way before that. In 1984, Ken and I spent a week with the Dalai Lama on one of his first visits to the United States.
That was a very exciting time.
It really was. In fact, it was a life-changing time for me, and I think for many of the people who were involved in that conference.
Yes. It was the first time that there was the dialogue between the East and the West, between Tibetan medicine and Western scientists and physicians to see what was the common ground and create a common dialogue. And having the Dalai Lama present at the University of Massachusetts at Amherst was really quite an event. So that was an amazing week, and I think for a lot of people it was a life-changing event.
It was quite an honor to be there. In fact, I think you and I were part of a group of 50 that included some of the top scientists in the world, some of the greatest philosophers of the time, and you know, we were in very hallowed company there.
It was an amazing time.
It's interesting, in fact, since that time that the influence of Eastern medicine has increased dramatically in this country and has been in part responsible for this whole new trend called alternative medicine or integrative medicine.
Well, there's been a huge upsurge in interest in alternative medicine or integrative medicine really for at least the last 15 to 20 years. And there were two surveys conducted out of Harvard that documented in the mid-90s how pervasive this was, but it had been going on for decades. And part of that has been the influence of people traveling abroad, of Asian influx into the United States, interest in traditional Chinese medicine, Japanese approaches, herbal medicine, Ayurveda from India, certainly all of the meditation and mind-body kinds of interventions from Asia have been a major thrust, as well as a greater awareness of the long-standing traditions in Europe, which use much more extensive use of alternative medicine in their mainstream medical care in the United Kingdom, in France, in Germany. And we're beginning to have a much more global perspective on what it takes to create health, to sustain health, and also to begin to solve some of the economic problems that our country is facing most acutely, but every nation on earth is facing an acute economic problem just providing health care to their populations.
I think particularly in the United States, the costs have gone out of sight, and that's in fact one of the reasons that people have turned to self-care or alternative medicine.
Right, and if you ask in the surveys that have been conducted, roughly 60% of the people, it's actually 58% of people who use alternative medicine say they use it for preventive purposes. And part of that, I think, is the baby boom, the aging of the baby boomers. Now they're in their 50s, they've always been very vocal, very outspoken, politically, economically, they've been very self-involved, both for better or for worse, and an interest in self-care, in maintaining vitality vitality, health, extended longevity has become a major concern of theirs, and rightfully so. They also are people who are now facing the limitations and the increasing cost to themselves and their families for medical care. So this interest in self-care, the preservation of health, knowing that they can receive the best of conventional medicine, but then wanting more. What else is there beyond the best of conventional medicine, and what can I use to maintain my health? Or if I become ill, what will help me if I have to go through a surgery? Will acupuncture help me with the pain? The answer is yes. And what can I do with diet and exercise post-operatively for a more complete, more rapid recovery? So it's not a matter of an either or. It's how do we begin to integrate the supposedly alternative methods and conventional care.
Well, that's what integrative medicine is. It's taking the best of all of those worlds and combining them for the best quality of health care.
Exactly. And some of these traditions have been around. Acupuncture, the Yellow Emperor's text, which is the classic, it's like the classic text in traditional Chinese medicine, talks about acupuncture interventions 1,500 years BC. So we have a 3,500-year-old tradition of acupuncture, of use of herbal medicine, of certain moxa, burning certain amounts of herbal properties on the skin, that has been around for that longer period of time. No system of medicine, no system of care stays in place for 3,500 years if it doesn't work.
You're right.
And now we're discovering and putting in place some of the scientific research and evidence to begin to understand that, but it's a very, very complex system. We literally are just beginning to understand that.
Well, I think the West has been pretty arrogant, actually, about some of these other methods of treatment that have been around for thousands of years. We felt that we were more scientific, we were more modern, but actually what we're finding now is that those are very effective methods, and they do stand up to scientific testing.
Very much. In fact, part of the discussions that have taken place in the last, with the founding of the National Center for Complementary and Alternative Medicine within the NIH, that 10 years ago, largely with the efforts of Senator Tom Harkin, really established a research site for evaluating these kinds of therapies. What you find is that much of what is done, the vast majority, and this is a number of studies published in the mainstream medical journals, the vast majority of therapies that are used in conventional medicine do not have an adequate scientific basis. The estimates range from 30 to 40% of what is done day in and day out in conventional medicine has an adequate scientific basis. That means 50 to 60%, maybe 70% of what is done does not. By contrast, if you look in certain areas of alternative medicine, like acupuncture, there is, for the particular conditions for which it's most widely used in the United States, largely pain syndromes, the scientific evidence is actually much stronger for the use of acupuncture than it is for many of the other therapeutics that we use in attempts to manage pain. So if you look objectively and you just say, okay, let's have an evidence-based approach, put the best of conventional and the best of alternative together in an integrative medicine, then science actually works in a very positive way to increase the science base for traditional conventional care, as well as to validate some of, and invalidate, to dismiss some of the claims from alternative medicine.
Kenneth and I, or Ken rather, and I are attending a conference on integrative medicine put on by the Aspen Center for Integrative Health. And it is very interesting now that there are many, many studies being done on very arcane subjects, such as African witch doctors and how effective they are. And they are subjecting these things to scientific testing and proving that they do work. And as you said, you know, some of our own Western techniques have not been subjected to such rigorous testing. So it's kind of bringing the bar up, I think, for everything.
I would agree, and to me that's the best part of this, is that let all boats rise with the tide, which is we need to improve the quality of care. We need to have more cost-effective care. The United States, as an example, will spend this year about 15% of the total gross domestic product on the provision of medical care to the population.
That's shocking, isn't it?
That's staggering. It's about $1.4 trillion. Now, what is astounding is that there's no other nation on earth that even spends double digits of its gross domestic product. The next closest nation is Germany at about 9.8, Canada at about 9.6. And just by way of a rapid contrast, if you look at the United States spending this year about $5,000 per person per year, compare that to Greece, which spends about $500 per person this year on medical care. So these are the 20 NATO nations against which we index everything that we do in terms of economics, health care, status, health of the population. Greece, on every internationally accepted measure of health, longevity, heart disease, cancer rates, etc., ranks higher or better than the United States at 1/10 of the annual cost. So someone might say, well, that's the Mediterranean diet.
Oh, really? Well, if so, let's do it
ourselves.
ourselves.
Do it, which I think is, by the way, I think it is
being recommended now, in fact.
But every nation between the United States and Greece ranks higher or better than the United States on the vast majority of indicators of health. So the bottom line is that money is not the issue. We are spending the most of any nation. The question is, how do we reallocate that? How do we make more intelligent and informed use of that as individuals, as corporations, as governments? What do we need to bring into our system to improve the quality of care and either level or reduce those costs? Because every other nation on earth is in fact doing just that. We need to learn from other countries.
Many of those countries that you mentioned do have national health insurance or a health program. So this doesn't make sense. You know, if they are actually providing that kind of care for everyone and their costs are lower, what's wrong with this country?
It's true. And now, to be fair, part of that cost in the United States has to do with high technology, with the more extensive research that's performed here in the U.S., but the other part of it is, so that's on the positive side. So some of that excess cost is clearly to great benefit, and people from all over the world come for intensive and invasive kind of procedures to the United States. But on the other hand, there are estimates that roughly almost $600 million is simply spent on excess administrative costs for processing a claim. Every time you go to a doctor for an encounter, if you take the United States and Canada, which have virtually identical health outcomes, and you say, what is one of the major sources of difference between cost in Canada and cost in the United States? It's the pure administrative costs that are less in Canada than the U.S. So some of this is just pure waste. And those are the areas we really need to begin to attend to. The other part is, you're absolutely right, which is the United States and South Africa are the only two modern nations that do not have universal health care. At the present time in the United States, we have somewhere between 45 and 48 million people in 2004 who do not have health insurance coverage. Their primary care is emergency room access, if they can get to it and if it is in a reasonably timely way. That is shameful. I mean, that's
that is
horrifying,
shameful.
you know.
And I've been to South Africa, and I would have to say, you know, the United States is a much more modern country than South Africa is.
Right.
So to compare those two nations is almost laughable.
It's astounding. So we have a large burden, and you're right, they have actually at lower cost by being more judicious about what constitutes care and how to use it more efficiently, including more alternative medicine in the population.
Including African witch doctors, as a matter of fact. You know, when I was in South Africa, I actually went to see an African witch doctor. I'm very curious about that sort of thing. So when I travel, I go to visit the local alternative practitioners. And a lot of their health care for much of the population, a huge amount of the population, is provided by those medicine men and women. And so there's really, every culture in every time has had a tradition of the indigenous healer, be they witch doctors or a shaman or the barefoot doctors in China or the medicine men in traditional North American culture. They all have traditions of the healer who uses chanting and herbs and looks at the family unit and the idea that it takes a community to raise a child, it takes a community to improve the health and well-being of a person. There's a wonderful story about Ivan Pavlov, who was the
father of classical conditioning.
I
and
remember
very
Ivan
rigorous
Pavlov from my
science.
psychology training, yes.
There it is. That when he was very ill, he had what was diagnosed to be a terminal illness. And his assistant, he knew he was dying. And his doctor had said, you've got basically 24 hours to live, make peace. And Pavlov asked his assistant to go down to the banks of the river and bring back buckets of mud. And so the assistant brought back buckets of mud, and Pavlov put his hands into the mud and went into kind of a reverie. And the next day his fever broke, and then he progressively got better.
Wow.
And it did in fact not die on time.
Mm-hmm.
So the assistant got very excited, and he said, this is miraculous, because the mud must have some healing properties, and we should really make this known and study this. And Pavlov says, no. The mud has absolutely no healing properties. He said, but when I was a child, I used to play in the mud by the side of this river with my grandmother, my babushka. And he said, I had such wonderful positive memories. He said, when I put my hands into the mud, I went into a reverie, and I remembered all the happiness and all the joy and the unconditional love I experienced as a child. And he said, that's what cured me. It was this surrender to the unconditional love, which I thought was rather remarkable, coming from such a hardcore scientist.
Story. I really like that.
Yeah.
And I'm sure that we're now discovering why that would be so. When we're experiencing joy and pleasure, we produce certain hormones that are healing.
Correct.
So Pavlov didn't even know that, but intuitively, instinctively, he knew what to do.
Exactly. Exactly.
It really is interesting to me, in fact, what you were saying about every culture having its shamans, its medicine men, its healers. And they do seem to have universal traits or practices that they follow all over the world. I've looked into this myself all over the world. Who are those shamans and healers in our culture?
Right. Well, I think part of what is now being restored is the fact that the high technology of medicine and the use of increasingly potent pharmaceuticals has removed the physicians and the healers from the act of interacting with patients, of touching patients, of looking them in the eye. In California, it's probably the same here in Colorado. The average length of time is 9 minutes, a 9-minute encounter with a patient.
We can all relate to that. The doctor zips in, zips out, gives you a prescription, and
Prescription
that's
is
it.
gone. That's being lost. And part of what, and you can see this now, there's a group of medical schools called the Academic Consortium for Integrative Medicine. There are now 25 medical schools that have both research and clinical practice and teaching in integrative medicine. And a core theme in that is we need to reinstate the art of the healer, the art of listening, the art of touch, the heart of being the therapeutic presence, of helping people through various forms of mind-body techniques or healing practices or prayer, whatever it happens to be, a way to elicit hope, a way to interact with patients that gives them a sense of confidence that they're being listened to, that they can do better. And we know that this has an effect. It has an effect in surgery. It has an effect in whether or not a patient is going to really use and appropriately respond to pharmaceuticals. Every pharmaceutical that's ever been tested has something called the placebo effect, which is people not giving the pharmaceutical do equally well if they expect to do well. What we need to know how to do now is, as healers, is to reinstate the emotional therapeutic relationship, and we need to maximize the person's own power of healing, the belief in their ability to influence the course of their disease. Rather than trying to eliminate it, we need to find out how to maximize it.
I think, in fact, mentioning the placebo effect, I remember in my own training that was sort of discounted. Well, that's just the placebo effect. That doesn't count, it's just something else that doesn't matter. But in fact, the placebo effect is extremely important.
Well, if you think about it, every pharmaceutical study that's ever been done always has a placebo control. Virtually every study of every pharmaceutical has attributed the outcome to 10 to 30%, that's the range, of placebo effect. Now, if you look at all the pharmaceutical agents, all exhibiting a 10 to 30% placebo response rate, the conclusion you draw is that placebo is the single most effective therapeutic agent that we have, because it means that it has a positive influence on a wide range of conditions that are addressed by virtually all pharmaceuticals. So rather than dismissing this, we need to know what does that? How do we elicit that? How do we sustain it? Norman Cousins had a wonderful phrase which he called the nocebo, which is the negative influence. A cancer patient is told, you have 6 months to live.
Oh, exactly. Yes.
So the negative expectation is very, very powerful. We don't want to provide false hope. What we need to provide is circumstances that research really does tell us you can elicit the placebo response. You can elicit the healing force of the individual to help you as a clinician to make the outcome as positive as possible.
Well, you're right, it can go both ways. And I don't think for many, many years physicians have realized the damage that they have done by the negative statements that they make or the negative expectations that they give to people, because people do tend to fulfill those in
Yes.
one way or another. There have been many studies on that. In fact, one I remember about a certain cancer drug that was hailed as the new miracle.
Right.
And people were having spontaneous remissions all over the place. And a few years later, they announced that it really wasn't the drug that they had hoped it was, that it was totally ineffective. And those same people instantly reversed and died.
Correct, and there are other stories like that, and more than stories. So it's actually, as you know, a documented event. And it's very true. There's one, there's a paragraph that I use in when I first meet my residents each year, and I ask them. I say, I'm going to read you a paragraph, and I'm going to leave off the first line. And I want you to think about, is this a reasonable description of what happens in a hospital with a person who has end-stage disease, be it heart failure or cancer or whatever a terminal disease might be? And so I read them this paragraph. And it says that when a person has a pronouncement or is nearing death, that they're placed in a different context. People withdraw from them. The doctors or the practitioners relate to them differently. Everyone around them relates to them differently. And they suggest in both subtle and overt ways that death is near and the person needs to prepare to leave the world of the living. In 15 years, I don't think I've ever had a resident say, no, that's not a fair description. So, okay, now let me read you the first line. And the first line is from Walter Cannon, who was the Harvard physiologist who formulated the fight-flight response.
Right.
This was written in 1938. And the first line is, this is the mechanism whereby the individual succumbs to voodoo.
I was just thinking that. I thought at first you were talking about voodoo, because that's exactly what voodoo does. It
Right.
isolates the person. They're expected to die, and they do.
Right. And he was fascinated by the phenomenon of voodoo death, which he did study in Haiti, because he believed that was the most extreme example of suggestion-inducing stress leading to, in effect, premature death. And so, again, finding these aspects in the tradition, Western healing tradition, you realize that everything we're calling, quote, alternative, really has been part of the Western healing tradition. Nothing, acupuncture, actually, Sir William Osler in 1840, I believe, actually talked about acupuncture. Herbal medicine has been part of the European tradition.
Of course. In fact, our country, as I understand it, originally all of the hospitals were oriented towards homeopathy and herbal medicine.
Correct. I mean, the Flexner Report, which really created the standards for what we call the modern medical schools, was really a very political document. And at the turn of the century, more than half the hospitals and more than half the practitioners in the United States were homeopaths. But there was an antagonism between the homeopathic and what evolved as the allopathic world. And through a whole rather complicated series of political and other issues, the Flexner Report really ended, if you will, the ability of homeopathic practitioners to become licensed, become certified in their states to practice. That's being now revisited. There are now national certifications and licensings around the use of homeopathic medicine, which has prevailed. It did not go through that same negative change within the European community, and is very much part of traditional care.
Well, homeopathy almost disappeared entirely in this country,
Correct.
as well as herbalism. And I myself was very ill. And in fact, I myself was in one of those situations where I was isolated, told I was going to die, I should write out my will. And I thought, hell no. I'm not going to do that. I had a different reaction. But I
Good
had
reaction. That's exactly the reaction. That we would
a healthy
want.
reaction, I
Yeah.
think. I wasn't going to buy into that.
That's right.
And in fact, I ended up, from that very incident, being sent to Europe for treatment. where I was treated with homeopathy and herbs and all of the things that at that time were illegal in this country.
Yes.
Chelation therapy. I could not get chelation therapy in this country.
Yes. Yes.
And now, that's 20 years, almost 20 years later, this is what we're calling alternative medicine, which is coming back around, and it's coming back from Europe, from the East, and it's about time.
It is, and in the last, I'm astounded to see what's occurred in the last 10 years, which is serious research in all of these areas. There are probably 200 or 300 research trials going on right now in virtually every major academic medical center in the United States. So you have 200 or 300 serious research projects looking at every aspect of alternative medicine: homeopathy, placebo effect, traditional Chinese medicine, acupuncture, traditional healing systems, Chinese herbal complexes, etc. So all of these areas are now at least being examined for their effectiveness, and I think we'll sort it out. Some of them are not going to be as effective as perhaps we'd hoped. Others are going to be astoundingly so, and then the job is to how do we now integrate these approaches.
I think you said in your book, Mind as Healer, Mind as Slayer, that medicine started out as a mind, body, spirit
Yes.
endeavor. It has taken a large detour into, we don't know quite what, I guess what we call scientific realms that have denied all of those things, and now it's coming back again. It's coming back around.
In the healing traditions, if you look at the Hippocratic Oath and the very roots of Western healing, you find that there's a tremendous emphasis on the spirit, on the role of the mind, the relationship between certain depression, premorbid, really morbid depression, and breast cancer incidence. Galen, the Greek physician, first noted that relationship. He didn't know if it was causal, but he said there's a relationship there. So it's always been, and then with the advent of the pharmaceutical, and rightfully so, the extraordinary breakthroughs around the antibiotics predominantly, and public health measures probably even more so, but the advent of technology, surgical procedures, the advent of antibiotics and other sulfa drugs, etc., we really did believe that there would be one cure for a particular illness, the magic bullet approach, one therapeutic intervention per condition. What we're beginning to realize is that for certain acute episodes, that is true, and we've done a great job. The problem is with chronic disease, it is a complex of issues, of socioeconomic issues, race, gender, ethnicity, belief systems, social support, stress, and viruses and environmental deterioration. Those cannot be solved so simply. And so we've begun to turn our attention back and say, okay, what are the elements we need to elicit health, maintain health for individuals and groups? And that is a new trend, because chronic diseases are the issue now, not the acute diseases.
Yes, I recall also reading in your book that at that time, in fact, infectious disease was the problem. It was the killer.
Correct.
And in our current world, it is the degenerative diseases, the chronic diseases that have become the problem. So we have to go back to those lifestyle changes, even the spiritual beliefs, maybe even go back to shamans and herbalists and all that, which we are doing, actually.
Yes. Well, if you think about it, if you think about surgery as the height of, in effect, Western medicine, that is a very shamanistic ritual.
Yes.
There are elaborate robes. There are elaborate procedures. There's an induction that goes on. There's the use of various sleep-inducing drugs that are used.
You're going into an altered state. Yes.
The person is placed in an altered state, and there's been some fascinating research on perceptions that people have, even under anesthesia, that they are, in fact, part of their mind is awake and is paying attention to what's occurring around them.
And they do hear what the surgeons are saying in the operating room.
And
that's
therefore,
been proven.
people have become very, very cognizant of what is said in the OR. So if you look at the whole ritual, the garb, the ritual, the entry into a sacred place, the recovery, being placed in a separate environment and coming out of the anesthesia, etc., that is a very, very shamanistic ritual. And to me, what's fascinating is it's beginning to be recognized as a shamanistic ritual. So there are surgeons now who actually have, if a if a person is interested, they'll have prayer before or some kind of relaxation techniques using guided imagery or meditation. In fact, Blue Shield of California conducted a very sophisticated study with people with elective abdominal surgeries and had them use a guided imagery tape or not, and found that the guided imagery had less complications during surgery, more rapid and complete recovery, less use of postoperative pain medications, and more rapid discharge from the recovery room. So that study now, Blue Shield,
That's a step forward, isn't
stunning.
it?
So now Blue Shield fully reimburses for the use of meditative and guided imagery tapes with patients undergoing elective surgeries. Now that's a great example of, if you need a surgery, you want the best possible surgeon, unequivocally. But you also want to know what to do before, during, and certainly after to maximize the likelihood of a positive outcome. So this is where it becomes exciting. It's not either or. It's how do we create the best possible system.
Well, I think anything in isolation is sort of dangerous. You know, when you take something away from the elements that it should be with, it becomes something that is not healthy in a way. And I think that's what happened with a lot of our medicine. And you know, perhaps that was necessary to develop the level that it has been developed to with research and so on.
Exactly. And there are concerns now with the use of herbal medicines. Most herbs are not used in the highly extracted form that we're tending to create a pharmaceutical-like industry around herbals. So highly potentized, highly refined, highly concentrated herbals, when in fact the indigenous use of herbals are as teas, as foods, as additives to foods. They're used very, very judiciously in very, very different ways. And we know that the intact herbal has different properties. And we also are beginning to realize that certain herbs can be used in highly concentrated form, but we also have to remember the ancient adage, if it's potent enough to have an effect, it's potent enough to do harm. And that is the case. You take St. John's wort. It is unequivocally effective for mild to moderate depression and has been compared to Prozac in studies and found to be equally, if not more effective, with fewer side effects. Problem is, what we also forget is that St. John's wort interacts with a lot of other herbs and a lot of other drugs. So we need to know that, one, yes, it does work, and it may be superior for some people, but we also have to be cognizant of the fact of what other things it may interact with to use it most judiciously. So we need to apply the same rigor to it, but not to begin to highly potentize and to abstract and get into the single magic bullet approach in alternative medicine that we've misapplied in conventional care. That's a real danger right now.
That's true. And there's some people have the attitude that just because something is natural, it's good. And that's not necessarily true
not
at all.
Arsenic is perfectly normal. In high dosages, it'll clearly kill you. So no, that's a major misconception.
You did make a good point that, and again, as I was saying, and you acknowledged that if things are used in isolation, they may be dangerous if you don't realize the interaction that they have with something else. There are many, many vitamins, herbs that may be all right on their own, but if you're taking it with another medication, it can actually kill you.
Absolutely it can. And we're becoming more cognizant of that. So at minimum, practitioners need to be open. In the 2 or 3 major surveys that have been conducted, one thing has not changed, which to me alarms me very much, which is somewhere between 60 and 70% of people who are using alternative therapies do not tell their doctors.
That's
now,
right.
That's a serious issue, because how do you know if a drug you're prescribing is going to be interacting with an herb, or how do you know the therapeutic positive outcome, maybe due to what you've prescribed or it may not. So we need to at least be open and receptive, and to the patients that come into a clinic, be it chiropractor, nursing, naturopathy, conventional medicine, it really doesn't matter what the clinical environment is. We need to convey to people they're not going to be met with ridicule. When they're asked, why would you not tell your doctor? They're afraid either they'll be ridiculed or they'll be dismissed from that practice. The person may refuse to continue to see them.
I think that they have been. I've had that experience myself when I told a medical doctor or two about the alternative things that I was trying to help to improve my health. They dismissed me.
Right.
They insulted me. They said, what? They thought I was an intelligent person. What was I doing going to quacks? Yes. And I thought, well, it's helping, it's working. What's wrong with that?
Yeah.
But many medical doctors are very closed-minded, or they have been in the
It's
past.
beginning to change. I think
Yes.
the overt negativity has really changed, because you find now the NIH has this enormous research center. 25 medical schools have major programs in integrative medicine. Journal of the American Medical Association has had a special issue on alternative medicine. In fact, several in several of the subspecialty journals, like Annals of Internal Medicine, had a series on alternative medicine. The Federation of State Medical Boards, which is the centralized body that issues advisory to all the state licensing boards, now has a policy which is very not benign, if you will, but it simply says whether a physician uses something that's judged to be alternative or conventional is not cause for legal action or for questionable practices. It really is standard of care, no matter what you use. Now that's a very large
That's a big
advancement.
step forward, yes.
The American College of Cardiology is about to issue a white paper examining the use of alternative medicine within the domain of cardiology, which again will be quite positive in the sense of evidence-based. There are some things that work, some things that don't, in other areas. So there has been an enormous sea change, and you see much more in continuing education. So I'm actually quite optimistic. I think there's much more flexibility within conventional care than we give it credit for, and also the new doctors that are coming up through the ranks are not so close-minded about these issues.
Well, that's true. They're in a different generation. They've had different influences, and they are much more open-minded. I must say, you yourself have been a very influential figure in all of this. As I recall, you started one of the first alternative medicine clinics at a prestigious university, Stanford.
Yes, we did. We did do that. When I went to Stanford in 1990, there was no real alternative medicine, and then in '94, we actually were one of the first centers for that were granted research status by the National Institutes of Health. And our focus, when I was director of that program, we called it the CAMPS program, the Complementary and Alternative Medicine program at Stanford, and our focus was healthy aging. What were all of the interventions ranging from diet to nutrition to mind-body to use of acupuncture, etc. We did some of the first studies on the use of Tai Chi to prevent falls and fractures in the elderly by allowing them to practice balance. So we were one of the research.
It's a long time ago, 1990.
94.
94. What's
10 years ago.
10 years
and
ago.
And then I believe it was around 97 or 1998. Oh, this interesting. Peter Van Etten, who was the chief financial officer at the University of Massachusetts in Amherst, was one of the people who put together that meeting with the Dalai Lama that we attended.
Oh, really?
Peter Van Etten then came to Stanford as the chief financial officer and then became president and CEO of the Stanford Hospital. Under his edict, we then created one of the first functioning alternative medicine clinics within an academic medical center. The longest standing one is actually at the University of Maryland. It was founded in 1991 with a focus predominantly on acupuncture, herbal medicine, and pain. Ours was the first functioning clinic that had acupuncture, mindfulness meditation, nutritional counseling, appropriate referrals, etc. And it's still functioning. I think it was a very significant step. It is adjacent to the main hospital, and that was a very large step forward. And it grew largely out of having the university community appreciate the fact that what we were doing was rigorous, and we had a very stringent set of criteria that we helped to go through the hospital and say, we'll use evidence-based practices. There has to be a faculty member with expertise in that area, and that person has to be willing to oversee and supervise the clinical program that's being offered. And with that, there was actually tremendous positive receptivity from oncology, from the pain control units, from cardiology. To me, one of the more interesting things we did is we actually started a mindfulness meditation program for people who are about to undergo organ transplants, because that's a time of enormous stress for the individual and the family. And one of the nurses suggested, why don't we have something that allows them to manage their stress levels? And that actually has turned into one of the most popular and successful clinical programs.
Well, good for you. 10 years ago, as I know, I've done this show for over 10 years, this was all considered fairly heretical,
Yes.
if not really illegal almost.
Well, our first step forward was was really to say, we're not advocates. We really are, we're taking an agnostic approach, but we need to sort out these issues. And that, I think, is the healthiest possible approach. We do need to find out what works and what does not. And with that approach, that was within academic medical research, that's supposedly what you do. You ask and attempt to resolve through a rigorous manner significant questions. And that's how we positioned the entire program, and it's still, you know, how we operate.
Well, you have taken that scientific medical approach and applied it to the alternative field, which is legitimizing it and as you said, bringing up the standards as well.
Correct, and we're working with now large corporations and health plans because now they're interested in what can they take from alternative medicine and incorporate into their medical plans for their employees.
Well, that's
this
a
has always
bottom
been
line thing.
A bottom line issue.
It's with the healthcare costs. It only makes sense for these large corporations to pay attention to the health of their employees and preventively, because they have such high costs of attrition, of people leaving their jobs through illness.
Exactly.
It really is to their benefit to do something up front about that.
Exactly. In fact, literally this month, we're just beginning a clinical trial with Ford Motor Company, funded by the Ford Fund, which is their internal foundation. And it is focused, we're calling it an integrative medicine intervention for back pain. And in the year 2001, as an example, Ford Motor Company spent between $70 and $75 million on medical payments for back pain. That's not disability, it's not replacement worker cost, it's not decreased productivity, that's pure medical payment. They have 12 clinics that do nothing but back pain care 24/7. And their medical director was part of our corporate health program. He was complaining about this and saying, can't we do something better? So he said, well, what do you do? There's a mandatory treatment period of 6 months for someone who injures their back between the time they can go into disability and potential litigation and compensation. So well, what do you do in your clinics during that 6 months? And he said, well, here are the protocols. So we looked at them and we said, you know, this was great medicine about 20 years ago. And he said, well, what would you do differently? And we proposed to him an intervention that would include acupuncture, more appropriate referral to chiropractic. Chiropractic is a covered benefit, but the chiropractic referrals were terrible. They were inappropriate. When would you refer? Why would you refer? What were the indications for referral? What were the contraindications? Also the use of yoga and stress management. Also looking at depression, which we know is a major predisposing factor to back pain. And if you don't adequately address depression, then during the treatment of back pain, the person will probably present again with back pain. So we proposed this integrative medicine model. So the control, if you will be usual care in one of the Ford clinics, and our intervention will be then this constellation of usual care plus these other measures. It's going to be a 2-year program. We're going to train their clinical staff to deliver it, and we're going to look at pharmacy use, how effective are we in returning people to work, does this increased cost initially eventually result in a return on investment because people are not coming back in for treatment when they go back into the workforce, are they more functional? Now that's an example, if you will, of a very practical bottom line business issue, which is this enormous cost of back pain, using an integrative medicine approach and a very rigorous scientific model that says, is this working and what are the components that might help us to do this? That is a major trend. We're going to be doing a great deal more of that in this next 10 years.
And back pain is only one of the problems that people have, especially corporate executives who are prone to heart disease, stress-related illness of all kinds.
Correct. We actually conducted early on, because of heart disease being such an issue, that's still the #1 cause of death, disability, and cost for virtually every major corporation. It's
of
still heart
course, they
disease.
get their executives trained, highly paid, and they have a heart attack and they're gone.
Exactly. And we conducted some early work with pilots of a major airline. They had over 13,000 pilots, and as you observed correctly, most of them are males. They're now middle-aged, high risk. Circadian rhythm disruptions are a risk for cardiovascular disease. Their diets are awful. They're just eating fast food. Terrible stuff. High stress, high demand job. And we began to work with these pilots and interacting with them over their computers, because they all have laptop computers for scheduling purposes. So we developed a delivery system of, in effect, delivering alternative medicine for heart disease, but delivering it through their computers. And we were able to illustrate that we were able to decrease, in a dramatic way, the amount of heart disease, the amount of high risk in pilots. About 80 pilots a year were disqualified from active flying status. Now that is a terrible loss, as these pilots usually are at the time where they're flying international routes, the large jumbo jets, et cetera. Based on that protocol that we developed, then Stanford Hospital became a center of excellence in the application of these kind of interventions for pilots, and we've gone on to other airlines now. So these are ways in which to take a very practical problem that's a cost issue for a company and saying, look, we can improve the health of your employees, especially your senior executives, but also the same programs apply all the way down to the people who literally clean the factories and do the day in and day out work at that level. Baggage handlers as an example. And we can do so in a way that is very cost effective. That message is beginning to be more acceptable because there are now more than 140 studies in large corporations that have demonstrated that this can be done.
I would think, since people spend so much time at work, that these large corporations or any business owes it to their employees to take care of them, to help them.
Yes, and that philosophically, we've heard that. You know, we care about our employees. I mean, what employer says they don't?
Well, I think that they think they do, but they just sort of ignore even the warning signs of illness approaching in these people and work them to death sometimes.
I would agree with you. And up until about 5 or 6 years ago, there was a very strong movement in health promotion and disease management, identifying high-risk individuals and on a voluntary basis giving them programs that would improve their health, whether it was back pain, chronic pain, cancer risk, complicated pregnancies. Bank One is a major national bank that has a very sophisticated program for their female employees who have pregnancy complications or potential for high risk that includes free on-site consults with an OBGYN on a regular basis. And they found it's extraordinarily cost-effective. It reduced C-sections, earlier return to work, very high level of satisfaction among their female employees. So this was, a very positive step.
I would think just the fact that people know that the company cares about them would activate some of that placebo effect.
It would.
They would be happier, they would be better workers, they would have less absenteeism.
Exactly, and then and you're absolutely right, and that is what the studies show. Higher levels of satisfaction, people to stay with the company, performance levels go up, productivity increases. About 5 or 6 years ago, with the advent of managed care, everyone thought, well, now the problem is solved because we're going to put in place all of these various co-payment structures, we're going to eliminate certain coverages, and in fact, medical costs went down. The problem is that we didn't do anything to resolve the underlying issues, which are risk factors in the population. And since about 2 years ago, now we're back to 15, 16, 17% rate of inflation. So companies, again, are beginning to revisit, and prominent companies, General Motors, Ford, Xerox, IBM, are beginning to revisit, Johnson & Johnson, revisit these programs and say now, although we've talked prevention, and we've said that we want to take better care of employees, now they're beginning to put more serious programs in place because they have to. This is now a truly viable solution because we've exhausted what managed care can do. We've run that gamut.
Well, I've actually spent some time in Japan, and the large corporations in Japan literally take care of their people. It's like their family. They are, and they're so happy, they're so devoted to their companies, and as we know, they're very effective, they're efficient. I think we can learn a lot from those kinds of systems.
Yes, there's absolutely a great deal to learn, and we see in the newspaper headlines now some companies defaulting on their promise to cover individuals post-retirement.
Oh, dear.
And
What a betrayal.
it is a betrayal, and there will clearly be class action lawsuits. It's going to be very costly. That's not a solution to the problem. Other companies who are seeing that are beginning to realize that if you begin with your active employees, who are very easy to reach, they're at work, they're functioning, you can reach them very easily. You can also reach dependents, spouses. And also, if a person is engaged in a risk reduction program, we know that a person, let's say, goes through a cardiovascular risk reduction program for X number of years, after they retire or after they really incorporate the lessons, their health actually improves. So they become healthier post-retirees and do not make excessive claims. So there's a much more positive way to resolve this financial crisis than just saying we're going to remove benefits.
Well, again, it's the bottom line. You know, I think the results are proven that it works better to provide the benefits than to withdraw them.
Yes, it does. Exactly.
Or
And
not
yes, it
provide
does.
them.
Yes, it does. And I think, as you mentioned, I think certainly the placebo effect does kick in. If a person is happier at work and is interacting in a positive way with their peers, we know that social support is a powerful mediator of disease. Whether or not a person feels connected to a family, a friend, it could even be a pet. And there's some fascinating research that shows it could even be a plant.
Well, whatever you love.
Whatever you love.
It helps.
If there's
the act of loving is healthy.
Yeah, people that garden have longer life expectancies. And there was a great, I love this study because, and this was conducted out of Harvard, they went into a long-term care facility and they gave half the people, they gave everyone a plant. But to half the people, they said, this is your plant, but don't worry about it. The nurse will feed it, water it, turn it on light. But it's your plant. The other group, they said, this is your plant. If it lives or dies, it's your responsibility. No one's going to take care of it but you. They came back 12 months later, and what they found was astounding. The patients who had, they called them the active versus passive care. So the active care patients all had, and the staff did not know systematically which person was in which group. Active care people all had better psychological and medical histories, less illness, less complaints, less emergency room treatment, et cetera. Secondly, they had higher voluntary attendance. They just kept track of attendance at a weekly movie. So more people in the active plant care group attended the weekly movie. What was most astounding, and I've forgotten the exact figure, long-term care homes plan on about, they call it a 30% quote turnover. It means 30% of the residents will die within a year. So they plan that in their financial offerings. It turned out that the passive care group had about a 25% mortality. So they kind of fell statistically within what you would expect. The active plant care group had a 12% mortality rate. So they had reduced by 1/3 the actual level of mortality in the act of caring for this little plant. I thought that was an astounding study.
We all need a reason to live,
Yeah.
even if it's just for a cactus, even if it's for a dog or a cat or anything, another living being, I think is so important in our health.
Very much.
And again, that interconnectedness. We're moving back towards a holistic view of the world, a mind-body-spirit view of the world, and more oriented towards community and
Very much.
integration. I think this is a very healthy thing.
Indeed, it really is.
And you certainly have been a pioneer in this. We haven't even mentioned your 10 books that, that have spanned from the 70s until now.
Yes.
Maybe you could just give us a quick little synopsis of some of the work that you have done.
Well, it's been a trajectory. It began in 1977 with the publication of Mind is Healer, Mind is Slayer, which is still in print. And it was really the first book. This hopefully it doesn't sound too whatever, but it was really the first book that documented, said on a scientific basis, what do we know about mind and body, and how can it heal, and how can it hurt, and looked at that whole issue. And in 1977, that was really a rather heretical approach. The working title of that book at Delacorte, Doubleday, which was the press, was American Stress. And when I wanted to call it, and I was also involved in a meditation class and very intensively, and it was a Zen-based meditation. So mind as the slayer is mind is a slayer of the real. Was a fairly traditional, almost mantra-like statement. And it came to me that, yes, it is, but also there must be a positive side, and that's where the title Mind is Healer, Mind is Slayer came from. When I contacted New York and said I wanted to call it Midas Healer, they hated it. They were absolutely livid. And it was a pitched battle. I actually, at one point, said, I'll give you back the advance if you let me call it. Look at that. Anyway, so that was that story. And then after that, there was one on holistic medicine, which really, again, looked at the scientific basis. As I wrote holistic medicine, I became very aware of the fact that the same factors that influence the quality of life have a profound impact on the quantity, how long we will live. And after that came a book on longevity, with the subtitle, Fulfilling Our Biological Potential. Everything we know about the human species is that we are designed to last about 115 to 120 years.
Really?
So we have to ask, why is the average death around late 70s, early 80s at this point in time if biologically we're designed to last 115 to 120 years? We still don't know the answers to that. Then I followed that with one called Sound Mind, Sound Body, and interviewed a whole set of prominent individuals. Norman Cousins, just before his death, John Fetzer, who then created the Fetzer Foundation, George Lucas, Lawrence Rockefeller, David Rockefeller. It was funded by Lawrence, it was a study funded by Lawrence Rockefeller. And looked at how did these people evolve their healthy practices so they could be in the world, high demand jobs, and yet maintain certain values, predominantly spiritual values, and saw their mission in life fulfilling those spiritual values and maintain a reasonable degree of health despite episodes of acute illness. They'd had cancer, they'd had mental illness, there was alcoholism, there was, heart disease, every conceivable illness. But how do people successfully cope with this? And that was Sound Mind, Sound Body. And then the most recent one, 2 years ago, was called The Best Alternative Medicine, What Works, What Does Not. And it just looks at alternative medicine, again, in a very scientific way. And it says if we look at the evidence in the 10 major areas, chiropractic, traditional Chinese medicine, acupuncture, herbal medicine, mind, body, and I developed a kind of triage. I said, what works based on the evidence? What doesn't work? We've studied it. It doesn't look like it works, so don't do it. And then what's in the works, which is what is the new research? We'll know the answers pretty soon. And we're now creating, we're literally in the midst of creating an online version of that so people can update the information. A book is always a year out of date. The day it hits the bookstores, it's a year out of date. So that's the rapid progression.
Wonderful. Well, we have rapidly progressed to the end of the show.
Thank you. It's
And
delightful.
I thank you so much for being here. It's wonderful to see you again,
It's
Ken.
great to see you. It's a
Thank
real
you for
pleasure.
being my
Thank
guest
you.
today.
Thank you very much.
Our guest today has been Dr. Ken Pelletier, who is a professor of medicine and one of the reigning experts on alternative medicine. I'm Dr. Patricia Hill, and you've been watching The Changing Paradigm into the Future. Please join us next time.
Wow, does this go fast?
Years, the companies of Kaufman Holdings have been technology leaders in high-performance lubricants for aviation and industry. Through biodegradable chemistry and enhanced productivity, the products of Kaufman Holdings save energy, reduce waste, and help protect our environment.